Hello, I'm Andy Petry from Arthrex, one of the product managers on the upper extremity team, and today I've got Dr. Paul Brady from Knoxville, Tennessee here with me today in the studio to talk to us about the Knotless SutureTak. Thank you, Dr. Brady, for joining us.
Thanks for having me, Andy.
Yeah, you know, one of the things that some of those that may be watching this video are wondering is what is the Knotless SutureTak and how does the Knotless SutureTak work?
So the Knotless SutureTak has a fiber wire suture which you pass through the tissue, and then you pass through a loop on the pull suture. You pull that fiber wire suture back into the splice locking mechanism, and then you pull tension, and that allows the tissue to be repaired down to the bone.
Where would you use this? Where do you find it most beneficial?
I started utilizing the Knotless SutureTak just for my inferior labral work because I liked the insertion technique for the old SutureTak, which has that stout inserter to move the humeral head out of the way. However, as I've used this anchor and had success with this anchor, my utilization has evolved to the entire labrum, as well as now utilizing it for most of my pasta repairs and my remplissage repairs.
I'd love to focus in a little bit more on your labral repairs, just to understand a little bit more about just a high-level understanding of what's your technique. How do you use the anchor? How do you insert the anchor and then tension the repair? Could you share a little bit with us about that?
Absolutely. So the nice thing about this anchor is that the technique is already familiar to me. I utilized the 3.0 SutureTak for a long time. The technique is very similar. I utilize an insertion guide, I drill, and then I fill immediately without ever removing that insertion guide. What that allows you to do is to keep that angle to lever the humeral head out of the way while your anchor goes into the bone. How I repair the tissue is I insert the anchor, and then from another portal, I'll shuttle the repair suture through the tissue. Then the last step is to take the repair suture and shuttle that back into the locking mechanism of the anchor. And at that point, you just simply pull on your repair suture, and that pulls the loop down onto the tissue and allows you to zip tie, essentially, the labrum back down to the bone.
Okay, well, so as you're talking about knotted repairs and this technique of using knotless, I'm sure some of our listeners, some of those that are watching, are thinking, I've been doing this for a long time. Why would I take the effort and all the work of changing from a knotted technique to a knotless technique?
Yeah, that's a great question, Andy, because I was a knotted believer, right? I felt like I could do excellent repairs in a knotted fashion, and I still believe I can do excellent repairs in a knotted fashion. However, there is a moderate amount of literature that's come out that has shown that there is significant variability even in the best surgeons' hands in regards to knots and the stability of those knots, whether they loosen or whether they break right at the knot stack. And so that got me fairly concerned about knots in general. Also, I've seen in some of my second look surgeries, I've seen where knots have migrated onto the articular surface of the glenoid and have done some damage to both the glenoid side as well as the humeral side. I've seen that fairly circumferentially. At first, I thought it was only a superior labral problem when you have abduction external rotation, that you could get some knot stack impingement underneath the rotator cuff, and I do believe that's the case. However, I've seen it in posterior as well as anterior inferior labral work as well.
So probably another question that comes up with that is, you know, somebody's got that down where they've got their knot tying technique. Is knotless more time consuming?
Yeah, that's a great question, and it has dramatically decreased my surgery time. There's no doubt about it.
I know you've been using the anchor now for about a year, and would you be willing to share some of your pearls that you've learned in using the Knotless SutureTak?
Very true, and with any anchor, you're going to have a learning curve, and I've had that learning curve. When I have a really hard bone situation, I will drill, but then I will cycle that drill one more time in order to remove that debris. What that does is when you place the anchor, it allows the anchor locking mechanism to still slide. Because if you get too much compression in that real hard bone situation, you may bind up that locking mechanism and make it very difficult for you to be able to pass that suture back into its own locking mechanism. So that's one pearl that I think is important.
Very good. Well, Dr. Brady, thank you so much for coming in today and sharing your insights with us on the Knotless SutureTak. And thank you for joining us. If you'd like to learn more information about the Knotless SutureTak, We'd encourage you to visit our website at arthrex.com, and of course, you can always reach out to your local representatives.